Well, you know what? I'm not probably going to need the pointer too much anyway. So first of all, I just want to say thank you for inviting me. It's really an honor and privilege. Cosme and Jimena are just amazing people, what they do. I am convinced they never sleep. That's the only way they can get things done here. Sorry, I keep moving this. Okay, so this first talk, I was asked just to sort of give my reflections on my 25 years of involvement with Jacobsen syndrome. And this will probably seem pretty random, but what I wanted to do is just reflect on some of the most special memories that I have over these 25 years, as well as the challenges that I have and continue to encounter in my pursuit. All right, so let's see. I better put my reading glasses on so I can... Yeah, okay. So my original goal was to identify genes that cause a specific type of heart defect called hypoplastic left heart syndrome, which is one of the most severe congenital heart defects of all the heart defects that about 1% of all babies are born with. And the goal is to try to understand the molecular and cellular mechanisms that underlie this disease, so that hopefully we can come up with better treatments, not just for children with Jacobsen syndrome that have this and other types of heart defects, but hopefully also to apply that knowledge to the general population of people born with congenital heart disease. And by the way, if anybody wants to stop at any time and ask me questions, that's totally fine. So this is a picture of the first person who was actually ever diagnosed with Jacobsen syndrome back in 1973 by Dr. Petrea Jacobsen, who was a geneticist in Denmark. And he is now about 5 years older than I am, which puts him in his late 60s. And last I heard, he's doing pretty well living in a group home facility. So he is one of probably the oldest known people with Jacobsen syndrome. So then in 1995, in July, when I was in my first month of cardiology training, is when I encountered my first patient with Jacobsen syndrome. And he was born with a form of this heart defect I'm most interested in, hypoplastic left heart syndrome. And because I knew that he was missing a piece of chromosome 11, that was very powerful to me potentially to help us to find a gene in that region that might be the cause of his heart defects. And so that really was the beginning of my 25 plus years now of trying to understand this disease and by finding the gene that causes it. And one of the things I found is that of all the known genetic syndromes that are around, in Jacobsen syndrome, there's probably the highest frequency of hypoplastic left heart syndrome. So from a strictly scientific perspective, this was actually a very fortunate observation. And again, to emphasize, my hope was that what I am learning from Jacobsen syndrome will apply to the rest of the children that are also born with this type of heart defect. So this is the little boy back in July of 1995 that I still take care of now, who is in his mid-30s. His name is Edgart. And so along the way, like I said, there have been a lot of challenges that I have faced and continue to face. One is just to get to know families like you and really to earn your trust, because you don't know who I am and what my goals are. And so a lot of that in the beginning was just to make sure we all understood each other. And I think it's become, as I think you appreciate, such a beautiful kind of win-win relationship between physicians, researchers, and families, how we all work together to help each other out. And you know, this group, the American group, the European group, I think are really models for how a rare disease support group organization should run. And again, congratulations to Jimena and Cosme and others who have done such a great job doing this, because it is a lot of work, correct? Yes. All right. So one of the challenges was, like you appreciate, just the idea of hosting these conferences. And so we had our first conference in San Diego in 1998. And except for the pandemic, we've had them about every 2 years. Most of them have been in San Diego. And it really gave me the opportunity to learn, mostly just by listening and talking to families like yours. And I'll be doing that again tomorrow as an example. And I continue to learn more, even now, 25 years later. It also has been for me, as not just a doctor, but as a parent of an unaffected child, to appreciate what the strengths are in your children and not just to focus on the deficits. And I know for me as a person, it's helped me to grow and make me a better doctor as well. And I think one of the absolutely most gratifying parts to me that I never would have expected necessarily was the wonderful people and friendships that have been formed along the way. So I just want to give you a few examples of some of these wonderful individuals. So this is Tristan, who I remember years ago at one of our conferences in San Diego, stood up and sang a song for 5 minutes, something that I, El Professor, could never do. Yet he's the one that has the deficits, right? So again, just very humbling reminder of how we are very biased in how we judge intelligence. This is Kara DeKemp. She's from Colorado. Until about 10 years ago, the last I had heard about her many years ago was that she had suffered a very massive brain bleed. And I never heard back from anything. And to be honest, I thought she had not survived that. And then one day, many years later, I got an email from her mom. And Kara survived that miraculously and is actually doing really well. This is Elise, who made it onto the cover of a very popular brand of cereal in the United States, Cheerios, all over the world. She is an up-and-coming actress. This is Elliot, whose father, some of you may know, Craig Thomas, not that you know him, but you may know the television show that he created, How I Met Your Mother. Really? That's his TV show. Yeah. And so Elliot, like his father, who's very musically talented, can do some amazing things on the piano. I have been witness to that. He can, with his back to the piano, if I play a note, he'll tell me what note it is that I play. That's pretty amazing. And he's also quite accomplished on the drums. This is really an exciting story. This is Heidi Sands, who lives in San Diego, and just last week, she won a gold medal at the Special Olympics in Berlin. So quite an accomplished athlete. This is Petey, who is really the inspiration of his high school baseball team. Really a great situation where I know that it's been great for him, but it's also been great for the team members to recognize Peter and what a wonderful human being he is and his family. This is something that will hit home to Cosme. This is Emmett Collins, who has run, I think, at least twice now in the Boston Marathon. And quite well, by the way. I think his time was about 3.5 hours. This is him from a few years ago with his father, Brian. What was that? I'm not going. Like I said, many of these people have phenomenal talents, better than we do, right? This is with his dad, who had run 25 years in a row the Boston Marathon, and very, very sadly, he passed away last year from brain cancer. So it's been a tough road for that family. But Emmett is just an amazing young man. This is my son with Elliot. Just one example for, as I mentioned before, how my son's life has been and continues to be enriched. He really doesn't even know what a disabled child means, because in his mind, all children are wonderful and beautiful. And as a parent, that's really what you hope for, is that we have no biases. This has been one of the most popular sessions at the U.S. conference, which, by the way, we'll be having again next year in San Diego, and I will use this as an opportunity. We would love to have families from Spain to attend that. And this is a really fascinating session where the young adults talk about some of their challenges and experiences living with Jacobsen syndrome. Music therapy, I think many of you would agree that your children with Jacobsen syndrome really have a special talent and passion for music. Music therapy is actually a very well accepted form of therapy now. In fact, in the United States, insurance companies often will support music therapy, and I think it really particularly gives people that have difficulty with normal expressed language to use music as a way to bypass some of those challenges and to be able to express themselves. And it's actually, I've seen this directly, and there's a lot of research that supports that, but it's really an amazing thing to see, let's say, a child who can't speak much, all of a sudden you start playing the piano and they sing up a storm. It's really an amazing thing to watch. And just the trust of your children, like I said, not just for me to earn the trust of the adults, but it's just such a beautiful thing. And of course, sadly, there are challenges when your children are too trusting, but it's a beautiful thing to observe. So when I really started my research, I began by spending 3 months with someone that probably most of you do not know, who was really a great colleague and friend back then, who I still remain in touch with, Chris Jones. So I got to spend 3 months working virtually every day with him to learn many of the necessary research techniques that I needed to then be able to start that back in San Diego. Some of you may have heard of Annette, who was the original founder of the Chromosome 11 European Support Group. And so they had their first meeting actually during that 3 months when I was in England. So Chris and I went to that in Holland. And that, again, gave me the first time I got to meet any European families and to meet some of the other families that, again, I still stay in contact with to this day, like the Barretts and the Zieglers. And at that same meeting, I met the only two other doctors at the time who had been doing work on Jacobsen syndrome. Some of you may know Teresa Mattina from Italy. And this is Dr. Remy Favier in Paris, who works at the Infantile Hospital something, Paris Trousseau. That's how the name came about. The Paris Trousseau is the name of the platelet disorder that hopefully all of you know about, very importantly. And Remy has really done a lot of the pioneering work that has helped us to come up with, hopefully, what you are familiar with, the bleeding protocol, which is truly now a life-saving piece of information because historically there were tragic cases of people with Jacobsen syndrome undergoing some kind of surgery, and people didn't appreciate the risk, even with a normal platelet count, because the platelets are still not functioning well. That could put your child at risk for potentially even a fatal bleeding complication from a surgery. And so this really started with Remy's research to lead to now where we are today, to hopefully never hear about that kind of tragedy again. And then in 2002, after some turmoil, Lindsay Carroll became the president of the U.S. group. So it's been now over 20 years, and just like you guys, has done a phenomenal job. And I know she would love to come to one of these conferences one of these years, and I would, again, love to have you guys come to San Diego and meet her and see what an inspiration she has been. She is also one of these people. She has actually 2 children with Jacobsen syndrome, and I don't think she sleeps either. All right, so as I've kind of alluded to, one of the things that I've certainly learned along the way, even though it took me a little bit out of my comfort area as a cardiologist, was to help to understand what all of the causes of disease and even death have been in people with Jacobsen syndrome. And so bleeding has clearly been one of the ones that, as I mentioned, now I think because we understand what is the basis for the bleeding problem and how to treat it, basically just be aware of it, and then you can prepare in specific ways to prevent bleeding complications at times of risk. The other big problem that, again, we've made great progress on is the risk of infection. And there have been a number of cases where children, infants, or adults have died from infections because it had not been appreciated that most, if not all children, people with Jacobsen syndrome have some degree of immunodeficiency. And I'll tell you in a moment about the 2 people that have joined our group that have been, again, tremendously helpful to come up with a protocol to recommend for your children to have a comprehensive assessment. It's variable between children, but depending upon what the problem is, there are relatively easy ways to address that, and I can guarantee you this has also saved lives of children like yours from fatal infections. And lastly, not surprisingly, congenital heart disease continues to be what now is, I think, now the most common cause of death in particularly infants born with Jacobsen syndrome and congenital heart disease. As I said, hypoplastic left heart syndrome specifically is the most common fatal heart defect in Jacobsen syndrome children, as well as the general population. So this is the bleeding protocol that we put into effect now over 10 years ago. At least in the United States, if you give your doctor this piece of paper with this information, they are legally required to comply with that. And it makes a difference. I wrote this paper summarizing 6 cases of brain hemorrhages. So that was important because, again, it turned out there are multiple causes with the underlying sensitivity because of the platelet problem. So, for example, things like high blood pressure, not a good thing if you're already at risk for bleeding. And we have found in some cases there are actually swellings or what we call aneurysms of vessels in the brain that, if untreated, can lead to a catastrophic event. The good news is by a relatively simple procedure, an MRA of the brain, a special type of MRI, they can identify those aneurysms, and there are ways to treat that even by a catheter-based procedure, which can prevent a catastrophic brain hemorrhage. So that was very important information to learn, and it was really Nigel Barrett who helped me to connect with these 6 families from around the world to learn more about what these risk factors are. So coming back, this is Ken Paris and Virgil Dahm. Ken is from New Orleans, Virgil is from Holland, who are the allergy and immunology doctors who have really helped us to understand the immunodeficiency problems that are common in your children, and most importantly, how to treat. And they have been just amazing. Anytime I have a question that maybe people like you will ask me, of course, I may not know the answer, but I go right to Ken or Virgil, and usually within a few hours they give me an answer and to help answer the questions that you guys have about various aspects of the immunodeficiency. So they are really a very important member of our little family of people. And of course, in 2015, this was really a great start for all of you. So this is, I think, now the 4th conference, right, over the last 8 years. So again, what a great organization this is. Thanks to Ken and Virgil, we similarly, like the bleeding protocol, came up now with this immunology protocol. And again, it's a legal document, at least in the United States, so if you give this to your doctor, they have to comply. Okay, so some of the other non-cardiac challenges, as many of you probably appreciate, perhaps is the longest problem that your children face, is the behavioral and the cognitive problems. And so I was able to get some of my colleagues in San Diego to work with me for a number of years. That led to beginning to understand more specifically what the problems are. We've actually found at least a few of the genes in 11q that we think contribute to these problems, and at least in one case came up with potentially a medical therapy based on the function of one of these genes. And this was really shocking to me. This is a family that I first met a long time ago at one of the European conferences. And this is Robin Olney, whose mom, Shirley, told me that her daughter had recently undergone a very comprehensive behavioral assessment. I think it was done in Belgium at that time. And she was diagnosed with autism. And that really came as a surprise to me, because I think many of you would agree that these children tend to be very social, in your face, almost too social, and so I really was a little resistant to accepting that. But that led us, thanks to my colleagues in San Diego, to do a systematic assessment to find that about 2/3 of boys and 1/3 of girls fulfill the criteria to diagnose autism. And with that, we identified a potential gene, one of probably a few genes in 11q that can lead to increased risk for autism. And based on that gene, we found at least one medication called clonazepam that may help, at least in the short term, for some of the behavioral problems, but there are definitely limitations because this class of medication, what happens, unfortunately, is over time people develop tolerance to that, and then you have to keep increasing the dose. And if you keep increasing the dose, then you get more and more side effects, and so it's very challenging. But at least for now, I think sometimes when children have very short-lived problems with behavior where they really have some kind of a deterioration, maybe a little short-term treatment with clonazepam can help them. Another drug that, again, in a couple of patients at least, that we learned in retrospect were being treated with a drug called buspirone, seems to help with daily living skills and perhaps with some of the sleep problems. So I'm putting that out there for my colleagues here who may be interested in pursuing some potential medical therapies combined with obviously other types of strategies to address some of these behavioral and maybe even cognitive problems. So we definitely need to do more studies. And again, I will be happy to hand this to you guys. I'm just a cardiologist, so this is way out of my area. And my two colleagues, actually, Sarah and Natasha, have recently retired. So for many reasons, it's time for me to hand this off to people who really have the interest and expertise. As you can imagine, COVID has been a huge challenge for all of us, including for those of you with children with Jacobsen syndrome. And many questions have come up over the last few years, but fortunately, touch wood, I'm not aware of anybody with Jacobsen syndrome having a bad outcome with COVID. The other thing that was really nice to know that even though in many cases your children have problems making antibodies to infectious disease agents, when given the vaccine, we've been able to show, at least in a few cases now, that your children seem to be able to make the antibody to the vaccine to give them protection against COVID. So that was a really nice piece of information. And that also was hugely important because many of you have wondered when or is it safe for your child to go back to school, right, to be exposed. And so having that knowledge that if you get the vaccine, you will likely have a good response to that and make it safer for your children to go back to school. Okay, so one of the ongoing challenges for those of you that follow the groups on Facebook is, especially for many of the new families like those of you here, is how do we get all this information to you? And so just in the past couple of years, I've had a wonderful college student she's actually at the University of Oregon, who has helped me to update our website. And I would really encourage all of you, if you haven't, particularly the new families, to check this out. One of the new sections that we added was something called frequently asked questions, which I think covers a lot of the beginning basic questions that many new families have. And then the other thing that Elena did was to list, at least up until the last year or so, all of the medical peer-reviewed publications on all the aspects of Jacobsen syndrome, clinical and scientific. And she, along with a new college student that's working with me, are going to continue to update this. There's probably close to now 150 papers that are published, and if it's kind of categorized by different areas of the syndrome, but every one of these papers now you can click and actually download the paper. And so that's an incredible resource, along with the other conferences that we've had where there are video recordings. So you can really spend a lot of time to learn a ton of information about everything that we know to this day about Jacobsen syndrome. And this is Elena, who originally wanted to be a genetic counselor, but after getting involved with this, this inspired her to actually want to go to medical school. So she is applying right now, I think, for medical school. Just last year, we published 2 papers on our cardiac research about the gene that causes different types of heart defects in Jacobsen syndrome. And this first paper, for example, was the culmination of about 10 years of work in my lab, done here primarily by someone by the name of Lizu Lin. I'll show you her in my next talk. And then the second paper was published also right around the same time last summer, led by one of the people in my lab, Dr. Lu Wang. And this was really the culmination of his 5 years of research that is giving us really exciting understanding of what we think is the mechanism that leads to hypoplastic left heart syndrome. So I've been really fortunate to have some great collaborators that I'll talk to you about more in my next talk. In the spring of this year, so literally in the last few months, we've had some preliminary, very exciting observations in which we have now we've taken the information that we've learned from our animal models to know what to look for in actually a human heart, in this case from a baby that died in San Diego about 8 years ago with Jacobsen syndrome and hypoplastic left heart syndrome. And what's very exciting now is what we have observed in the animal model systems is exactly now what we see in this first heart. And I'll tell you more about that in my next talk. What's obviously what continues to be the greatest challenge is the fact that still we lose a number of children with Jacobsen syndrome. Like I said, fortunately, bleeding and infections are less common, but still happening. Heart disease has become the number one cause of death. And this is just a list of the number of children that, at least that I know about from around the world, that have passed away over the last 5 years. And if you look on the very bottom, Sophia and Thorin are two babies that just both passed away 6 days apart back in May. And I just want to point out that these families have incredibly graciously donated to me their hearts of those two children to allow us to study further what we think is the cause of what led to their demise. So I hate to end on this note, but it is the reality of the world I live in about the challenge that I face every day that keeps me up at night and gives me some of these gray hairs that I now have that I probably didn't even have back in their first conference. And that is the challenge to get funding to keep this work going. So probably many of you don't realize that UCSD actually does not give us doctors any money for research. It's only for what we do by seeing patients, so it's up to me to get the money. And I've been very, very fortunate that most of my support comes from generous families and some foundations and grants along the way. But for example, I just found out a few weeks ago that the grant that we submitted to the National Institutes of Health, which is the primary funding agency for basic science and medical research, there's only about a 5% chance that you're going to get that. And we just found out it was not funded. So the challenge continues. Philanthropy has become a huge component, actually at least as much, if not more now, than entities like the NIH to support this kind of research. But as you can imagine with the economy, that's really caused a decrease. So it's really challenging right now, to the point where I may even have to shut down everything in the next year or two. So hopefully not. And this is one of my all-time favorite sports coaches. I don't expect you to know him, but he was a legendary college basketball coach. And there are a lot of quotes of him. But I love this one, make each day your masterpiece. And so that's what I try to do. And I think that's it. So I want to thank you. I hope I didn't exceed my time limit. So